Hello, sir. Good morning. So, sir, my name is Dr. Sir, one of the PACES candidate here today. I've been asked to examine your lungs. Sir, what I'm going to do, I'd like to have a very good look first, feel, tapping, and listen to your lungs. So, sir, do you have any pain at your chest right at this moment? No.
No.
All right. So, if you feel any kinds of pain or discomfort during this procedure, just let me know. I'll stop at that moment. Is it all right? Yes.
Yes.
All right. So yes, my dear doctor, immediately after entering the room, the station 1 respiratory system, you need to do the deep bundle packs altogether. So greetings, introduction, instructions, pain, position, and posture. So we finish the pain up to the pain. And now the position. For the respiratory system examination, you need to make the head and up for the 45-degree angles and expose the chest fully from the front and back to examine the respiratory system. So you need to tell and you need to make the bed up for the 45-degree angle. And you need to tell to the examiner, sir, I'd like to make the bed hidden for the 45-degree angle to examine the respiratory system. So yes, this is the 45-degree angle. So this is the perfect position for examining the respiratory system. Now you need to tell him, sir, would you please sit forward for me? Just put off your gown. Is that all right? Yes. So you can help him just to, yes, now let's sit, lie back for me. Oh yes, my dear doctor. So this is the perfect positioning that you can start the examination. Now this gentleman is ready to start to examine him. So yes, that you start your examination of the respiratory system. So yes, my dear doctor, listen very carefully. The station 1, abdomen and respiratory. Now this is the respiratory station that you need to rehearse before entering the room, that the steps of approach. So yes, my dear doctor, the steps approach you already learned. There is a symmetry, epidiameter is increased, the bronchiectasis and COPD and bronchiectasis. If the epidiameter is not increased, there is a fibrosis. So once again, the CP is symmetry, epidiameter, and then the crackles. If the crackles is positive, then this bronchiectasis crack is absent, there is a COPD. So once again, the symmetry, epidiameter, crackles. Now the asymmetry, the scar, lobectomy, pneumonectomy. Asymmetry, no scar. Then the Darwin percussion, there is a pleural effusion, pleural thickening, consolidation, collapse, and cancer. So this is the steps that we already learned. Symmetry, epidiameter, crackles, asymmetry, scar, and then lobectomy, pneumonectomy, and the trachea, asymmetry, scar, trachea. And the asymmetry, no scar, the Darwin percussion. So this is the steps that we already learned, the simplest approach that we can make the diagnosis. Now, my dear, listen very carefully. You entered the room that you have seen the instructions, the written here, the station 1 respiratory system, this man with a history of infertility, examining his respiratory system. So, history of infertility and examine his respiratory system. And whenever we just put off the dress and have found a scar, there is a thoracotomy scar. So yes, my dear doctor, that immediately after that I've seen there is a scar mark. There is a thoracotomy scar. So we can say this is a bilateral anterior thoracosternotomy. So I should say this is a continuous scar. So this is the thoracotomy as well as the sternotomy. So this is called the thoracosternotomy scar. So having a thoracosternotomy scar, or this is called the clamshell scar. The clamshell scar is indicating this middle-aged man is underwent double lung transplantation. So having the history of the infertility, underwent the double lung transplantation, so the diagnosis of the infertility, so here's a young syndrome is a likely diagnosis. So yes, my dear doctor, you entered the room, you have found the history of infertility, and you found the double lung transplantation. So the diagnosis, young syndrome, the underlying etiology of bronchiectasis. As because this gentleman underwent the double lung transplantation, so definitely the findings that we are expecting, the test, every findings will be the normal. in the test findings that we already learned, the trachea, immediately after the trachea, the CEP and BSBR, means the chest expansion, percussion note, breath sound, and vocal resonances. Every finding is the normal. So why there's a spot diagnosis that you need to make so that you can make your diagnosis in your hands. So we need to start the examination from the hands first. So yes, sir, could you please do like this for me? So I need to see that the findings of the clubbing, that you can see he has got a clubbing. And immediately after the clubbing, that you need to see that the nicotinic staining, so he doesn't have the nicotinic staining. So clubbing, nicotinic staining, he has got the clubbing but no nicotinic staining. So we can see he has got a clubbing changes here and also here, but he has no nicotinic staining and no wash, means that no wasting of the small muscle of the hands. So whenever you have the clubbing, then you need to exclude the other findings of the cancer bundle pack. There is a nicotinic staining, no nicotinic staining, no wash. So clubbing, nicotinic staining, wash. The other findings that you are expecting, that you go up, then in the eyes, that you need to look for the Horner syndrome, and then getting down to the SVCO, is the supravenacular obstruction in the neck, and also as well as in the neck that you are looking for the lymphadenopathy. So once again, Horner syndrome, SVCO, lymphadenopathy, and the chest, middle of the chest that you need to look for the radiotherapy burn marks. So yes, my dears, because we found the clubbing, no nicotinic staining, no wash, so less likely possibility of cancer. As because these gentlemen underwent that the spot diagnosis that we made, having a scar with a double lung transplantation. So it doesn't have any pathology right at this moment. But we found a clubbing that the previous evidence of the bronchiectasis that he has. Even after that, you need to compare with your own hands to see the pulmonary erythema, warm hands, pulmonary erythema. So no pulmonary erythema, no warm hands, and the bounding pulses. So pulmonary erythema, warm hands, bounding pulses, and the flaps are the features of the carbon dioxide retention. So no pulmonary erythema, no warm hands, no bounding pulses. Then you need to feel the pulse, to feel the bounding pulses. So no bounding pulses. And immediately after that, you need to count the 15 seconds, to count the respiratory rate as well during this time. And here's a normal respiratory rate. Immediately after that, you need to see the flaps. So, sir, could you please just cock up your wrist back and spread the fingers and need to see the flaps? So he doesn't have the flaps. So once again, he doesn't have the no warm hands, no pulmonary erythema, no bounding pulses, no flaps. So there are no features of carbon dioxide retention. So in the phase that what we are looking for, here we are looking for the Horner syndrome, and then SVCO, then the lymphadenopathy. So three important findings. Then you need to be very vigilant just to exclude the diagnosis of the diagnosis of the malignancy, unlikely diagnosis. So there is no Horner syndrome, no partial ptosis. Yes, but we need to see the anemia. Just look up for me to see the jaundice. Same, stick your tongue out for me. Tongue up. To see the anemia and jaundice, and also to see the, I'd like to see the gum. So there is no gum hyperplasia. Immediately after that, the face that in the neck, that the SVCO that we're looking for, there is no SVCO, no engorged veins here. And the lymphadenopathy will do at the end of the examination after the leg edema that you already have seen. And we'll see the leg edema. But you need to remember the features, the lymphadenopathy, and then getting down to the chest, that you need to see any other things on the chest, especially the scar mark and chest deformities that you need to look for the chest. So now the chest proper examinations, of course, that will do the trachea examination, but having inspections that we can see there is a scar mark. We call it the thoracotomy, but this is the sternotomy, so we call it the thoracosternotomy scar. It's basically the clamshell scar. So thoracosternotomy scar, that we can see the scar if you get closer, more closer. Then you can see the scar. You can see from the right, and there's a middle, that the sternotomy, and the left thoracotomy. So this continuation of the scar that we call the clamshell scar, that is done, if you found this one in the respiratory station, that you should think about the diagnosis is double lung transplantation. And my dear, listen very carefully, the double lung transplantation can be done by, nowadays, not this continuation usually done. Usually they will have a scar here, left inframammary thoracotomy and right inframammary thoracotomy. There will be no continuation, only these two scars. So this is done nowadays. So you will have the chances to get a scar like here and the scar like here without this continuation. So this is the double lung transplantation can be done by anterior thoracotomy scar if the continuation is not there. But if there is a continuation, the sternotomy scar, so this is the thoracosternotomy scar. And sometimes with this thoracosternotomy or maybe the anterior thoracotomy scar, you will have maybe the midline sternotomy scar as well, because the procedures need sometimes the midline sternotomy scar, made the midline approach. So yes, my dear, so this scar is nothing but for the double lung transplantation, the diagnosis is done. And with that one, sometimes the patient may have some of the medical breastplate, maybe on the hands. Usually the breastplate can be found, the breastplate, and you need to look at the hands. So he has no medical breastplate. So sometimes the medical breastplate having written there, the lung transplantation, the double lung transplantation done on 2019 or 2018, 2017, 2016 or something like that. So please be very vigilant to look for the medical breastplate immediately having such a scar. So immediately after that we have found the diagnosis of double lung transplantation, so we are expecting that every findings will be normal in his case. So you need to do the trachea examination, the tracheal position. Then you need to tell him that I'd like to see the windpipe examination, so trachea is central in position. Immediately after that, the CP and BSBR that you need to do. Can you do like this for me? Do like this? Yes. You need to put your hands like this, and you need to tell him, turn your head on the left side, like this, and take a deep breath in and out. So you see the chest expansion is really good. Yes, do it once again. So yes, once again. So very good chest expansion now at the level of the mid chest. Once again, take a deep breath in. So very good chest expansion, you see. Once again. So once again. So very good chest expansion that we found. So CEPN. Then the percussion note, then you need to tap on the chest. So there's a means the resonant sound over the clavicle. Then you need to put here, tap on the chest to find the sound, the normal findings. And over the axilla. So once again here, over the axilla. So CPN. Immediately after that, then BSBR. So immediately after the CPN, then the BSBR, then you need to put the stethoscope. Turn your head on the left side once again, put the stethoscope here, and tell him, take a deep breath in and out, all the way through your mouth. Once again. Once again now. Once again, that we are getting the normal, we are expecting the normal findings once again. Once again, once again, once again, once again. Very good. So this is the breath sound, then immediately after the vocal resonance, then you need to put. So once again, so sir, could you please tell me the 99 for me? So turn your head on the left side and say 99 for me once again. 99?
99. 99. 99.
Very good.
99. 99. 99. 99. 99. 99. 99. 99.
Thank you very much. And we found the chest expansion with the CEP and BSBR. Every findings are normal and there is no airway sound at all. Immediately after that you finish your front examination, then you need to go back to examine the back as well. Once again, the CEP and BSBR. So now onto the back that you need to examine the same things, the CEP and BSBR. You need to put your hands here and you tell him, take a deep breath in and out for me, sir. So you see the chest expansion, you see. Once again, the basal part. Once again. So see. So chest expansion is really normal. Immediately after the C, then the P, and for the percussion note, they need to put. So this, you see that in resonant sound. Yes. Immediately after the C, P, and BS, then the breath sound. The similar place that you need to put the stethoscope on here. Now take a deep breath in and out. Take a deep breath in. 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 Once again. Take a deep breath in. 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 So these are CEP and BSBR. Every findings are normal and with no error sounds that he found. Immediately after that, you need to just tell her that you need to see the neck glands. They need to see the neck glands for the anterior chain, and the posterior chain, and the supraclavicular lymph nodes that are not enlarged. And after the lymph glands, that you need to see the leg edema as well. And we have seen there is no scars on the back as well. So immediately after the lymph nodes, that you need to see the leg edema. And he has no leg edema. But what I have seen that he has some of the skin bruises and some of the skin thinning and shining, that we can see some of the skin bruises that he has. Many bruises in the skin, so he is on steroid. And both legs that you can see the skin bruises. So these are skin bruises that you have seen in both legs. And also we have seen some of the skin bruises over the left forearm as well. So you can see the skin bruises over the left forearm. Yes. So you can see the skin bruises here. So the evidence the gentleman is on steroid. So immediately after that, you felt that you finished your examination. You need to give the clothes back so you can wear the dress. So you can help him so that the examiners can understand, right? You're a really helpful doctor. And you make him comfortable as well. And say him, sir, you have done really excellent, sir. Thank you very much. Thank you once again. And giving good thanks to the patient and saying the excellent, making the total environment excellent. And if you felt finished your examination, you need to wash your hands. And then you felt that you finished your examination, then you need to come forward with the examiners and saying that, so I'd like to finish my respiratory system examination to do the bedside spirometry and the arterial blood gas analysis. And also I'd like to finish my full examination by checking the observation chart that includes the pulse, temperature, respiratory rate, blood pressure, oxygen saturation. And I'd like to also to check the urine district for the sugar, protein, RBC nitrites. And saying this 1 and 3 and the 2, all of them together, means the 3 bundle packs, all of them together, means that you finished your examination. You'll get the full satisfactory marks in the examination section. Immediately after the examiners ask you so many questions, or maybe you need to present your case, my dear. So yes, my dear doctor, then you need to present your case the way that you learned. You need to present your case like the way that I'm saying. My clinical diagnosis of this middle-aged man is bronchiectasis, as evidenced by clubbing. Bilaterally, fingers are clubbed. And also he has got the history of infertility. And also I have seen this gentleman also having the double lung transplantation, as evidenced by thoracosternotomy scar anterior thoracosternum scar, means the thoracosternum scar. And also, as evidenced by the bilateral double lung transplantation, as evidenced by the normal findings, means the trachea is central and the chest expansion is symmetrically normal, and the percussion node is tympanic, and the breath sound and vocal resonances are normal findings. Means the bilaterally the normal findings, all the findings that in my hands, meaning that he has got the new lung transplantations, means the double lung transplantation bilateral. And this gentleman is on steroid. So he has underwent the bilateral lung transplantation, and middle-aged man underwent the bilateral lung or double lung transplantation, and he's in steroid, as evidenced by the steroid skin thinning, steroid purpura, easy bruising over the both legs, as well as the left forearm that I have seen. And also as the history of infertility, and also having the clubbing. So I think this gentleman has got the bronchiectasis, and for which reason he had to undergo the lung transplantation. And the underlying etiology of bronchiectasis is Young syndrome. The differential diagnosis of bronchiectasis may be the cystic fibrosis as well. Because the cystic fibrosis and the Young syndrome will have the similar presentation in the respiratory system. But in cystic fibrosis, that we are expecting the man should be the short stature and the growth retardation, and having also the GIT involvement, and having the features of the malabsorption, and also some features of the GIT involvements. So the differentiating features, Young syndrome will not have the GIT involvement. The Young syndrome will have only the bronchiectasis along with the infertility with the sinusitis. But the GIT involvement will be absent. And the Young syndrome will have the middle-aged man. In contrast, the cystic fibrosis, the young adolescents, in our PACES exam that will get the questions like that. So putting all them together is because the middle-aged man without having DIT, or maybe I need to examine the abdomen more, to examine the abdomen as well, to get the any GIT involvements. But he has got the infertility, there's a strong involvement with him. So I think the gentleman is likely underlying etiology of the bronchiectasis, for which reason he underwent the lung transplantation, and having the clubbing, putting all them together, the Young syndrome is a likely diagnosis. Yes, my dear doctor, listen very carefully now. Having the history of the infertility, you enter the room that yes, the middle-aged man with the double lung transplantation, with the clubbing, with the steroid evidences, with the normal lung findings. The putting all them together, the diagnosis, the Young syndrome is a likely diagnosis. The underlying etiology of bronchiectasis you need to think about. And I hope that you enjoyed such an interesting case. And also you learned a lot of things together. So what things? Summarizing, you entered the room, you have seen the infertility, and I found the clubbing. So yes, of course, the diagnosis of bronchiectasis is due to the Young syndrome. And second differential diagnosis, the cystic fibrosis that you need to think about. Yes, my dear doctor. I hope that you enjoyed. Thank you very much.